video is on a condition known as stone man syndrome. So this is a rare genetic condition where the bone gradually replaces muscles and connective tissues. Injury or illness causes new bone growth, which can be painful and lead to a shortened lifespan. It can affect anyone because it is most often a result of a new genetic mutation that wasn't inherited from a parent. And as we all know, genetic mutations are unpredictable. They occur during fertilization due to an error when the cells divide and replicate. Symptoms include bone forming on the muscles, ligaments, and connective tissue, decreased mobility, problems with speaking or eating, hearing problems, having a big toe, malformed, permanent immobility, red to purple, painful hot touch areas, which look like tumors, and swelling of soft tissue in the neck, shoulders, and back. So this is caused by mutation of the ACVR1 gene. So the ACVR1 gene gives your body instructions to make type 1 receptors for a protein called bone morphogenic protein, BMP, that resides in your muscles and cartilage. This controls how bones and muscles grow and develop. Mutation of ACVR1 causes symptoms of this condition because the receptor is like a light switch; it is always on when it should be turned off. It's a progressive condition and it is autosomal dominant. So as I said before, they do occur because of a new mutation of the ACVR1 gene. Diagnosis is usually through a physical examination, a genetic test to identify gene mutation, an X-ray to examine new bone growth over muscle and connective tissue, biopsy of the FOP tumour. A diagnostic biopsy won't occur because the procedure can cause several bone growth flare-ups and malformed big toes and soft tissue swelling throughout the body. Treatment is to reduce symptoms. Right, so there's no cure, but there are research and clinical trials going on. So there's also genetic counselling, occupational therapy, preventive antibiotic therapy to avoid respiratory infections, medications to reduce swelling and pain associated with flare-ups, such as corticosteroids, non-steroidal anti-inflammatory medication, and muscle relaxants, wheelchair, and wearing a brace.